Today, we're going to talk about short-term care and Medicare and how to bridge the gap of maybe an area that's not completely covered by original Medicare and potentially your Medicare supplement. So first, I would just like to clarify that my name is Joanne Giardini-Russell. We have an insurance agency called Giardini Medicare, and we are an insurance agency. And that means that we handle all products that are related to Medicare. We enroll people into the new products. We help you and coach you getting through your A and your B, and then we get you a Medicare supplement, Medicare Advantage, drug plan, cancer plan, short-term care, indemnity plan, dental vision, hearing plans, things like that. So we do everything related to Medicare only. I want to point out too, always want to point out that we are paid by insurance companies. That means you are not paying an insurance agent for their help in getting you enrolled into these products. Okay, so no money comes from your pocket to us. We are paid by the insurance company as we enroll you into these products. If we provide you with good value and good information, we hope that if we work in your state, you'll happily enroll through us, but we are not paid by the client. Okay. And then after you do become a client, I can vouch for the fact that you're going to receive lifelong claims, billing assistance, and things like that. We answer tons and tons of questions for our clients all the time. And once you're a client, you are welcome to be asking all these questions of us. Also, let's talk about Medicare. Okay. So the reason we're talking about short-term care ultimately in this is because Medicare has about 65 million people in the system right now. In 2030, just in 5 short years, it's expected to be 80 million people. So that represents today 18% of our population, which is a really big number, right? So just the fact that it's going to grow by 5 million people, imagine the cost, right? The cost increase, the potential cuts that may happen. We don't know what's going to happen, right? But the basic premise is more people going in. It's going to be a costlier system for the government. And as we've seen over the years, a lot of the extra cost is going to be borne by you, the consumer. Also, 70% of those people turning 65 today will need some type of care. And by the time, they're 100 years old, let's just throw out 100 years old, right? They're going to need some type of care. Could that be custodial care, which we'll talk about? Could that be assisted living? Could that be skilled nursing? Could it be hospital care? All these types of things. Some of that will be covered by your Medicare coverage. Some of it will not be covered by your Medicare coverage. In talking about skilled nursing facilities, what we want to point out here is that Medicare will cover a skilled nursing facility care and a stay in that facility after you have 3 days of medically necessary inpatient hospital coverage. What happens here is sometimes there's a dilemma. There's an issue with observation status versus inpatient hospital stay. So we want to be careful that we are understanding the differences between those two. So this is page 28 of the Medicare New Handbook. Clearly, am I an inpatient or am I an outpatient? Whether you're inpatient or outpatient, that's going to affect how much you pay for hospital services. And what happens is Part A services and hospitalization coverage costs the government, costs Medicare more than Part B services. So remember, original Medicare has 2 components, Part A and Part B. So if a hospital, the system, essentially Medicare as a system, if they know that it's going to cost more to have people admitted into the hospital and it's going to cost them more, what do you know? We have observation. So instead, hold these people in observation status. Observation is billed to Part B as in boy. So you can see what kind of happens here. Let's go back to that slide ahead that says Medicare covers you after a 3-day minimum of medically necessary inpatient hospital stay coverage. If you are outpatient, you will not have that same coverage. If you are in the hospital for 3 days as an outpatient, which certainly happens, it's not super frequent, I will say, but it does affect about 2 million people a year. So if you're in there as an observation case every 24 hours or after 24 hours, you're supposed to be told by the hospital that, hey, you are under observation, sign this piece of paper that you are knowingly under observation. A lot of times people tell us that they had no idea. They were in the hospital. One person even said they had an operation and they were under observation status the entire time. Now that could be extreme, right? But the key is that it's not always easy to tell if you're under observation status or under hospital admissions. But again, going back to that whole premise of you have to have a 3-day inpatient stay to have your skilled nursing facility coverage kick in. So if you go right to the skilled nursing facility and you were under observation status, you're going to have 0 coverage for your first 20 days of Medicare covered traditionally covered skilled nursing facility coverage. Even if you have a Medicare supplement, the Medicare supplement is not going to step up and pay, because if Medicare doesn't pay for something, the supplement's not going to pay for something. So be very, very cognizant of that. Now, I'm talking today about pretty much traditional, original Medicare, traditional, original, whatever you want to call it. I'm not talking about Medicare Advantage plans. Medicare Advantage plans do not go and adhere by that 3-day observation status rule, but Medicare Advantage plans have different issues, different gaps in coverage. We're going to cover that in a separate video at some point, but those would be hospital indemnity plans, cancer plans, things like that. But again, today we're talking about pretty well original Medicare. What do you do to solve some of this? Like, how do you get that coverage if you are not covered? What happens if you're under observation, you go to skilled nursing, and you realize you have no coverage? Here are some of the things we can look at. So short-term care. So short-term care is an alternative to long-term care. When we talk about long-term care, that means in excess of 360 days. When your coverage, you will have coverage in excess of 360 days. Short-term care is designed to cover shorter durations of time up to 360 days. That's why it's called short-term care, right? We do not offer long-term care. We don't work with that. You could go to your financial planner or whoever you need to do to talk about long-term care. We offer only short-term care, because it's a real good dovetailing product with original Medicare and Medicare supplement. Now, people always want to know the cost. Like, what is it really going to cost if I needed to hire a caregiver? Or what is it going to cost if I had to go to assisted living or stay in that skilled nursing facility? I'm going to link to the Genworth cost of care survey here to kind of get your feet wet in terms of cost. I'm just going to put in a Plymouth, Michigan zip code 48170. And if you look at these, you're going to have an hourly button here that shows you a home health aid, $32, $33 average. If you want to look at a daily rate, here's your daily rates for home health folks, $207, assisted living, $196, and $449 for a private room in a nursing home. So that's nursing home. Okay, assisted living right in the middle. And then if you want to look at monthly cost can be a good gauge for us. Now, also realize that these costs are going to fluctuate based on where you live. Okay, I was working with somebody in Virginia yesterday. Assisted living was about $3,900 versus $5,900 in Michigan. So it really can change. So make sure you're looking at your zip code in this case. But it gives you a good feel for cost, because then we can take that over to a quote to see what kind of coverage might make sense for you. And now we get to the quote portion of this. And you can see on my screen, we're talking about Aetna. Aetna has a product called Recovery Care. There's several insurance companies that work in the same space, but I'm going to show you Aetna here. So Recovery Care, I'm going to show you a quote for someone in the 48170 zip code, like we showed on that prior screen. They were 65 years old today. It'll be effective in a couple of weeks, and they are female. So male, female. It actually doesn't matter, because it is like unisex pricing, and tobacco, non-tobacco doesn't matter either. So we go down to Recovery Care. That's the focus of today. And if you look at Recovery Care, it's got 3 different components. It's got a daily nursing facility benefit. It has a daily hospital benefit, and it has this optional home care rider. I'm going to focus on really 2 of these things, because I think they're the most important 2 things. So one is the daily nursing facility. When we say nursing facility, that means assisted living or skilled nursing. I'm going to show in this case where somebody, let's say that person is really worried about observation status and having that happen. Even though they have a Medigap plan, they're still very worried that something could happen, and it could, right? So let's go and put $200 benefit. And because we saw on there that a skilled nursing would be about $996 per day in that 48170 zip code. So let's try and cover that. And let's say that we're going to get a $200 benefit for 90 days. I want to make sure I can stay in there for 3 months. We just simply hit quote. So $31.69 a month. So that means that this person would get a $200 check from Aetna for the 90 days that they were in that skilled nursing facility. Okay? Maybe you're thinking that's not enough. These are the other options you can look at. You can get 180 days, 270 days, or all the way up to 360 days. Again, not quite 1 year, but 360 days. Waiting period just means how long it's going to take before you get your check. In this case, I set it for 0. Typically, we're doing 0 waiting days. We want you to have that money immediately. The other thing is that this is cash to you. So that $200 per day is going to you into your checkbook to spend as you see fit. Obviously, in this case, you're probably going to turn around and pay the facility, but you can do whatever you want with that money. Now, hospital indemnity. I typically don't put much in here. If somebody wants it, of course we would, but you're usually going to have hospitalization coverage through your original Medicare, through your Medicare supplement. Now let's look at somebody who wants to focus on the home care rider. So what's special about this product is the home care rider, truly. Now, the home care rider is for people that feel like, hey, I'm a little concerned about skilled nursing facilities, but I'm pretty confident my coverage is going to be okay with Medicare. I really want to focus on the home care benefit. What can I get for in-home care? so I don't have to be in the facility and I don't have to rely on my children and things like that. So with this rider, you can get a benefit from between $150 per week all the way up to $1,200 per week, up to 52 weeks. Your choices are 13, 26, and 52 weeks. So let's look at that person and says, okay, if I want $1,200 a week for 52 weeks, what is that going to cost me? In this case, the answer is $66.53, and that's per month. Now, let's say that's a little too high. Let's take it to 26 weeks. I want to show you how customizable this is, how you can really get backward, backtrack it to that premium sweet spot if that's what you need to do too. So you have $44 for 26 full weeks of $1,200 per week of cash benefits being paid to you that you can then turn around and pay for care. And we're talking about the home care benefit. How it works is that you are on claim, considered on claim with Aetna, as long as your doctor says that you need home care. And this could be custodial care. And custodial care means you are hiring somebody to help you with a minimum of 2 of the 6, what we call activities of daily living. Activities of daily living are the same things that trigger for long-term care products, but they also trigger for short-term care products. But the activities are bathing, dressing, eating, transferring, toileting, and continent. So let's say you can't bathe, right? Something has happened, you're sick or you're ill or an accident, something happened, you have to hire somebody to help you with bathing a few times a week. Also, you can't get dressed. Without assistance, you can't get dressed, okay? So you've now hired visiting angels, for example, and you're paying them $30 3 times a week. So as long as you're doing a minimum of 3 times a week and your doctor says you are going to need help with bathing and dressing in this case, and you are considered claim worthy, well, you would file a claim and Aetna would start paying you this $1,200 for up to 26 weeks in this case, whatever benefit period you selected. So as long as that continues, you're going to receive your $1,200. You will then take your $1,200, and again, that's payable to you in cash. And then you would turn around and pay the facility that is providing your care. Okay, you can go on vacation. You can do anything you want with that money. That is yours to have. It also pays in addition to other coverage. So if you have coverage elsewhere, this is going to pay in addition on top of that other coverage. So it's a nice little sweet spot of a product. Again, lots of people like to focus on this home care. And I just want to show you too, one more thing is that like if you picked a $600 benefit for 26 weeks, I want to show you how the price can keep going down. You're down to $23.64, and let's say 13 weeks. Right here. So let's see how cheap this gets. $15. So for $15 a month, you can have some care. So you have $600 for 13 full weeks. Now, I have not talked about the benefit period because when we put these at whatever we set this at, 13, 26, or 52 weeks, it doesn't matter. When you're buying this at a product, when you buy 52 weeks, you're really buying 104 weeks. The benefit period, the bucket you have of benefit doubles. So whatever product you get, if it's a 13-week plan, you're going to get 26 weeks ultimately. 52 weeks, you're going to get 104 weeks. It's not consecutive. So you cannot assume you're going to stay someplace and get 102, 104 weeks straight. You're not going to do that. You have to be healthy or not on claim essentially for 180 days, and then you would start a new benefit period. But it does have a restoration of the benefits, and 2 times is max, okay, and then it's over. That is exactly why Aetna and other companies can price these plans as they do, because they have a limited window of exposure. They know the worst case that Mr. Smith is going to cost them when they add up the numbers based on what you bought as a benefit. Compared to long-term care, they don't know what you're going to go through. They don't know the cost in 20 years, things like that. Okay, so that's why the pricing differential exists. Another thing to note is that let's say you start with just 13 weeks, just to have something out there. And then you come back in a year and you thought, you know what, I really probably should have taken more home care. And you're still healthy enough to qualify. You can do that. You can update your product, and then your new plan will replace your old plan. I personally did that. I bought this when I was 58, and I came back about a year later and increased certain benefits and qualified, and no problem. You just continue. The other thing to note is that this product is available for age 50 all the way up to age 89. All right, so the younger you are, the cheaper it is to buy it. You lock in your rate. Again, Aetna has never increased that rate in 34 years, so we're pretty comfortable thinking they're not going to increase that rate. So buy it younger. Okay, we get lots of people calling that are 50, 55 years old saying, hey, my dad is 85 and he needs certain coverage. Sometimes it's too late in that case. However, the 55-year-old really should be looking at this for themselves and locking that price in. So how do you get this coverage? We enroll you. So we enroll people into this product. You can email us. You can phone call. You can contact Aubrey. You can set up an appointment with Aubrey on the phone. She's our contact person, does a lot of our applications. Note that this is not available in all states. And for us, that means specifically Florida and California are 2 of our big states that it is not available in. Aetna and all the carriers have really been trying to get into those states, but the state insurance departments are always where the hang up is. But that's that's how you get that with us, and we'll handle all the details. Now, some resources, just want to quickly mention, don't forget we have a private Facebook group. So our Facebook group is where you can get lots of questions answered. Anything you want to bring in there, we will certainly answer them. And we have all these other resources, TikTok, YouTube, Transition to Medicare podcast. We have an online course. We do live webinars. And of course, go check out our Google reviews if you're interested to see what other people say about it. Here's how you schedule a call. You just go to our main website, gmedicareteam.com. You can hit schedule a free call. That brings you up to everybody, the agent's calendar. Here's a list of states that we operate in and how to contact us. If you need us, give us a shout, please.